Hi, I'm Dr. Bishop, and I'm here today with these guys. I'm super excited to share their story because they have just done remarkably well, and we feel that if we share the story, that we can help a few more people. So, tell me, what brought you guys in?
So June was suffering a lot of mental disturbances, and he was having repetitive thoughts of suicide and harm, OCD type of problems. He was completely depressed, tired, lethargic, just nothing, didn't really want to live. And we had been to plenty of medical doctors. Everybody kept pointing to him being basically psychiatric issues, OCD, that he needed therapies, he needed psychiatric drugs, and so we went that route, and there was no improvement. It actually made it worse, and he just slowly deteriorated more and more and more. And so I was like, there's got to be another way. So I started doing research. I'd seen homeopathic doctors before and naturopathic doctors, and they had helped me quite a bit. Mm-hmm. So I was like, well, let me see what we can do for him. I wasn't sure if people would accept. So kids. So we found you, and I was really hesitant at first because when I came in, I was like, what can you do? Everybody else has said he just needs therapy. And you had asked a ton of questions, and I was like, well, what can you do with that information? And they were very specific questions that matched him. And so it was crazy that you could pinpoint what he was thinking and how he was feeling and why he was having those issues. And then when we got the blood work back, we had found that he had more than just psychiatric issues. It wasn't even really that.
Yeah, way more. So with June, there was some underlying infectious things that were affecting his brain and his thought processes, as well as multiple head injuries. And initially when I asked you about head injuries, you were like, no. And then as we started talking, share what you told me. How many concussions did you have?
I had one when I was a baby, and I've had 5 since then.
4 or 5. Yeah, brain.
Right.
But those are pretty recent though.
Yeah.
The last year.
Yeah, the last couple of years.
And so as you've been going through this treatment, how much better do you think you are? Share when you knew this was going to actually help, because you were pretty hopeless.
It was the first day that we did a breathing treatment.
Yeah.
They put it up to my face, and I was like, oh.
Yeah.
But then we got in the car afterwards, so probably 30 minutes right after.
Yeah.
And I was ready to cry. I was like, I feel normal.
Yeah.
And then
from one breathing treatment. And then we've continuously done breathing treatments, and he had done IV therapies for the mono and the bacterial infection. We had done antibiotics, and he's like a new person. He's back to himself, because I was like, when am I going to get my kid back? Because he was...
And he's back.
He was not. Yeah.
So he's going to keep working.
Yeah, it's amazing.
Thanks, guys.
Awesome.